Hey everyone, thank you for joining us today for another episode of Self-Discovery. And this is Dr. Mojisola Edu, and we have the wonderful, amazing, phenomenal, international advocate, Dr. Ramneek Dosanjh, live in the building, and she is going to be talking with us about everything that she's doing in the world, changing the world with her voice, with everything she's doing in health, in the UN, internationally. And we're going to deep dive into her journey and what brought her to do the work that she's doing now. And before we get started into all of this, we usually pull the affirmation card, but you got a couple of things to say to the audience before we get into the affirmation card? Real quick, Doc.
Alrighty, thank you so much for having me. So much gratitude for being part of your actual amazing following and to be in this time and this place at this moment. So thank you.
Well, thank you for joining us. You're amazing, and we love all the work that you're doing in the world. So let's go ahead and we're going to pull this affirmation real quick. And today's affirmation says, all is well. Everything is working out for my highest good. Out of this situation, only good will come. I am safe. How does that resonate for you today, Doctor?
Oh, I received that. That is exactly what I needed to hear. And I think oftentimes we want things, but this is exactly what I need. And you're absolutely right. I think using my voice and having courage to speak up and speak truth to justice. And I really do believe that that's been part of my journey thus far, but it's only beginning. And I love collaborating with you today. And thanks again for having me.
Definitely, it's a blessing to be here with you and to connect with you. So those who are joining in, Dr. Ramneek has been doing amazing work. She was the president of Doctors of BC, that's British Columbia in Canada, in 2022 to 2023, and is the current incoming president for the Federation of Medical Women. This is the 100-year centennial anniversary this year, and also has attended the UN and spoke on panels with the American Medical Women's Association to lend her voice to make change and advocate for things that need to change in this world. Unfortunately, we still have to raise our voice for issues that we thought already should have been changed a long time ago, which is very, very sad as the climate of this world and things are changing. But let's go back. What led you to do the work that you're doing? Have you always had this passion to do something bigger than yourself? And what influenced that for you?
Sure. Yeah, I think I've always known, at least since I was a young girl. At the age of 12, I knew that I wanted to pursue a career in medicine. I saw my grandma be sick when I was young. I was 6 years old when I lost her to cancer, and I thought that was a very pivotal point in my life as a young child, witnessing that, but also watching the doctors intervene and help her with her end-of-life care. Also, the encouragement, and my father was a very influential male figure in my life. He always dreamed a bigger dream than we could have. He was an immigrant to Canada, but was an athlete and an academic, and really wanted us to have all the opportunities that most girls in my culture, at least from my village, ancestors never got the opportunity. So pairing with that and being the child of immigrants as a first-generation Canadian, I really felt compelled that I needed to leave the world a little bit better. Our journey and struggle is a little bit more difficult at times, being a person of color, and especially a woman of color. The opportunities maybe you might be marginalized in some of the places. So we knew that excellence was not an option, but it was something that we just had to attain. And I held that for my brother and my sister as well. I think we hold very similar common core beliefs of doing what we can and really making the lives of those around us better, and trying to, while shattering this glass ceiling, trying to keep the door open for other people to follow in your footsteps. So.
Wow, that's beautiful. Also, I'm a child of immigrants, with Nigerian American coming to America, and then it's not easy. It's a different type of struggle, and that makes you just appreciate life so much more. Coming through that. Um, and so you went to school, support from your community, family and everything like that. And I know it wasn't easy, especially being a woman of color and going through all of that. But you came out and you were working, in the hospitals and different places like that. But what said I needed to raise my voice and speak on these big platforms and say, no, change needs to happen now?
I think so I trained in the US, I trained in Atlanta, and I saw segregation, I saw disparities firsthand, and the privileged versus the underserved and underprivileged, and the duality of, some may say the capitalist society or what has been created around us. And Canada's no stranger to that either. We definitely have our most vulnerable populations. We have our Indigenous peoples that there's still a journey towards truth and reconciliation. And just witnessing that firsthand as a healthcare provider, as a physician who is trying to participate in the lives of humans and help them with their health and their well-being. Well, health and well-being is so much more of a continuum. There's so many things and factors that influence health and outcomes, especially as we know in our most vulnerable populations and those that are disadvantaged. And oftentimes when we think about equity and inequity, people say for equality, but equality is not fair either. It's not a matter of giving everyone the same building blocks, because people, start at different places, and some of us don't have that necessarily building block that's created in fairness and equity in the beginning. So I believe watching and witnessing and participating in care for people that didn't have access to care, were in different insurance programs. I've worked with Medicare, Medicaid, TRICARE. I've worked with many insurance providers and those that don't even have insurance, and working with them. Health should not be a negotiable. Human rights in general should not be negotiable for anybody. Everyone deserves equal care, and to be able to provide that care also resonated that I felt that people, their socioeconomic factors that were influencing health, their access to clean water, to sanitation, school programs, to food. I could talk about this for days about the food deserts, and where it's easier to feed your children on low income, unhealthy choices, because the healthy choices are so expensive, and where land and crops and farming is just not conducive in certain areas, or have access for people in metropolitan or highly densely populated areas, as well as issues of gentrification. There's so many things that are complex that are working with health and justice, both in an intersectoral kind of pivotal point where we notice the gaps, and really what it affects is people's lifespan, and it affects their communities, their health, and their relationships. And so that is what really motivated me and the change when seeing that, but also growing up and realizing that privilege was something that needed to be earned, and some people get handed down privilege and others have to work really hard for it, and others may never see it or never may know their deficit or what they are lacking compared to others around them. So I think we take an oath of do no harm, and so participating in this healthcare system, part of the healthcare systems do harm themselves, and so being vocal and noticing the inequities from day one, and realizing that this is not fair and this is not how we should participate, at least in what we consider a first world developing nation, and one of the ones that applauds themselves and being such an upstandard around the world. I'm noticing that was really what really leaned and cultivated an environment in which, it begs you to question everything from your pharmaceuticals, from the input, from the insurance coverages, but also back in Canada, healthcare is accessible to everyone. But then again, even with that, there's many disparities depending on where you're living and your access to a hospital or healthcare setting or a primary care provider. So those are some of the things that definitely, compelled me to get in there and use my voice and stand up for what is happening. And other situations such as the primary care reform things that I helped create, the change was that the doctors on the front line, the first line, the primary care physicians, were not paid equitably and to see patients. And it was based on volume incentives, which creates a situation where people get paid to or remunerated to see more people, as opposed to really taking their time and seeing patients. And we knew that women in the workplace were definitely being affected, and inappropriately so, in the way that if you're spending more time with your patients and if you've got a patient population that needs more time, such as mental health or immigrant refugee health, or just in terms of creating an environment where people are feeling safe, because there's a lot of people that have not had the opportunity to feel safe with their providers, and taking that time to ensure that they have trust and safety with what your plan is for their healthcare is really important. And so I feel that we created systems that they're a colonial system. They're based on the colonial system, and they need to be decolonized. So you have to use your voice in order for change to happen. And oftentimes you develop this learned helplessness, and you are thinking, how can I affect the system? I'm one person, or I'm one physician in my clinic or in my hospital setting. But I do believe that the one voice can change, and you have discussions with your peer groups and your communities and your administration, and you push for a different change. And eventually you push enough, you'll get noticed by the government, or leadership opportunities will come forward in which you can lend your voice when, people say that you tell the truth even when your voice shakes, and that's absolutely true. And I think that we shouldn't be intimidated when we're speaking truth. And when you're on the right side of history, and then you're on the right side of truth and reconciliation, then I really do believe that humanity will be impacted by those choices. But as you can attest and notice, there's been a lot of erosion in the faith and belief systems of what's happening and humanity. So I do believe that even now is the time to really embark on bold leadership, courageous leadership, and creating voices without the fear of what is going to be happening with retaliation or intimidation. All the movements, if you look at the civil rights movements, or if you look at all the times where oppression was so prevalent, and times of injustice where people felt that they didn't have a voice. And so for those of us who are professionals or in settings where we really can push the envelope for our patients or for the people, I think it's absolutely necessary that we do.
And that's beautifully said. You hit the nail on the coffin right there. You just basically, we're looking at just the world. I mean, we're in the uproar right now with the world, and it's a dis-ease in the body. It's a dis-ease in the world. And you lending your voice is making change. And even though people might think that their voice is small, like you said, you're really changing and making big impact. I commend you for all the work that you do, because I know it's not easy. And dealing with these systems that are set up for us to fail, they're not, and dealing with just Western medicine, and looking at Western medicine, and now the integration of just integrative health. What does that look like, especially because I know a lot of people aren't even getting access to that. They're not getting access, like you said, accessibility to clean water, things of that nature, even sanitary napkins, or it's being weaponized for menstrual periods. These things that we find as, oh, this should be common sense. It's a disparities to some people. Where do you see medicine, or just, access to health in the near future for people in the world?
Well, I feel when people say that you hit rock bottom, it's only up from here. I mean, it's devastating what you're seeing unfolding, both in the US and Canada, around the world. I find it very troubling, especially from a human rights framework, that there's things that are appalling. And I had a colleague the other day say to me, when did human rights become so radical? And especially even with the recent findings within your own Supreme Court, and homelessness now could be a crime. And those are the things that really strike you, as even the overturning of Roe versus Wade. I know we felt the waves up here north and have been still devastated and quite troubled by it, trying to reframe policies for people to understand that humans matter and all humans matter and life should be treated equally. But as long as we don't oppose the rhetoric, I feel, unfortunately, so many that consume media these days, it's unparalleled and it's not fact-based necessarily. And so when we really speak within our circles, I feel that if we can change and collectively harness the potential of people that are humanitarians or doing the good work, fighting the good fight, I think we need to collaborate, because we can't necessarily look to our government to, give us leadership. I feel we're in the era where we need to ensure that healthcare, justice, and education are viewed as nonpartisan and non-negotiable, in the sense that everyone deserves an equal opportunity at life and healthcare. And so I think there is going to be a change. I'm hoping that there's a collective of humans that are going to get together and organize in a sense of, this is what our people need. And that's what's happened. We've noticed over history and periods of time that great humans do come together. There's bits of philanthropy and humanitarianism happening every day as we speak, despite what the government will decide or what people will decide and make change. But we really have to ensure that we continue to push forward and educate our youth, educate our communities to understand the devastating consequences and the sequelae that these decisions can have. And not until people see the impact on families. And I feel sad because I also have recognized that I do bear some significant privilege in my life. I have an education, I have a job, I have enough income to provide for my children. However, there are so many people that don't, and they lack the education and the simple resources, like you're saying, the period poverty situation. That's globally we're seeing it, but we're also seeing it here. And the fact that that's happening here, this shouldn't be, we should have an answer for that. And I'm hoping that even the big corporations have hearts in which they want to help humanity and do the right thing. Where providing products, providing healthy alternatives, primary prevention of care. Education is really big. And I think that our circles of caring, so whether it's your church or your local community where they embrace you and want the best for you, it's leaning into educating every single person. And I think we are, the gift of even what you're doing here is social media presence and having an ability to reach people in their homes or provide alternative narratives that, give people hope. And I think that's the main thing here, is that with hope and collaboration and committing to really challenging the status quo continually, but it's going to take all of us, and it's going to take a lot of our youth in our empowerment. And I know some of the work that you do in the outreach, that is how we change people's minds, is really healing the hurt. I think there's so many people in pain. And this, if I can even call it post-COVID era, in an era where the world stood still and we look for leadership, but it also caused a lot of fear and it caused a lot of uncertainty. And what do people want now? They want control. And so how do they do that? They create these external control mechanisms in which they think that will ease that pain, but not until you really confront where the fear and the pain and the suffering is coming from and heal those wounds, are we going to really be able to change the decision makers. And the other side of things is really trying to put people that are change makers in those positions that can actually see the greater good for humanity.
You're right. I agree with you absolutely. These systems have been ancient, and it's time for them to be dismantled. And like we said, we talk about, we're talking about grassroots. We're talking about local, state, and government. we're talking about international, to be everyone to be on board to say, hey, it's time for a change. And it starts with these policies. These policies are only benefiting those that are sitting to benefit from them, and we have to start looking at the whole, especially when it comes to, humans. People are grieving. They don't even know they're grieving. People are grieving. People are moving out of fear, and it's sad, especially for the youth, as we look at like education and just looking at the children, the disparities of children not being able to read. The literacy level is terrible. Bridging the gap between the home and schools and family, because we talked about privilege, like you said earlier. Some of these parents can't read. This is not their mother tongue. They're speaking a totally different language, English, and even the English taught in America is different than the Queen's English that you might learn when you're in another country. So these different things, we're still not bridging that gap. And now you see more schools, they're integrating the family connection and the bridge. And also, you might have a teacher that hasn't done their own healing, right? And they're trying to help a child. How are you helping a child if you still haven't done your own healing? So a lot of this is like, how are we healing ourselves? How are we standing up to make sure that we are conveying the message? And are we reaching these people in these rural areas, in these small areas that we've never heard of? We can't just go to the cities because some of them don't have access to internet and social media. How are we using these things? That's another thing I want in regards to accessibility. What does that look like? If you had your way, right? You had all the policies backing you and you had the green light. What does accessibility look like for you? If you could design it in the future to meet people where they're at in this day and time, what would that look like for you?
Oh, I think that would be accessibility would mean that everyone has equal opportunity to access the services that exist, and be it where they are. So if people are living, for example, here are Indigenous people, to meet them on their land, on their reservation, on their terms. That is accessibility to me. And meeting people, I used to do home visits when I was in Atlanta, and meeting them where it is for them. It's most comfortable for them. Delivering their insulin or whatever they need to their home, and understanding their hardships and what is keeping them from being able to access care. We don't even think about before the appointment, before people arrive, how we inconvenience them, how we inconvenience full families. There's grandparents that are looking after children, and there are parents that are working, and the dynamics of what happens in a household. How amazing would it be to be able to have these mobile health units in which we can show up for people at where they need it? We saw this during COVID. We know we can pivot. We know we can deliver medication by drones. We know we can do all sorts of things with technology. And that is my hope. I mean, I think when I think dream, I have big visions of what we can collaborate and be proud of. I mean, I think we need to get away from this partisan agenda, because it just pigeonholes us and keeps us from the innovation, and keeps us from really aspiring to do large impact. I mean, imagine how powerful our nations could be if everyone was fed well, was healthy, was literate, and had all of the access to contribute to the society. There's so many unfortunate negative opinions and narratives that exist in this space that say that, even, for example, people will say the immigrant refugee populations, and what are they doing? They're questioning their impact or influence, but that's so different from the facts or what's statistically relevant. And we know that when we give people access, when we give children that have not had an opportunity to participate fully in education, for example, they've not been fed well. They come to school hungry. They have high ACE scores, and ACE scores are the Adverse Childhood Experience scores, which has been very well articulated by your very own Dr. Nadine Burke-Harris and Dr. Bruce Perry's work. But when you look at that impact on children, and if they're even have high adverse childhood experiences, we know that if we can mitigate the risks by increasing their resilience factors. So accessibility for me means education, healthcare, justice, and really allowing the people to flourish, and providing them areas in which they feel they can contribute and influence. Most people need a sense of belonging, and most people want to contribute greater than themselves. Unfortunately, the way our world and our leadership circles have been set up traditionally, following government policies or what they decide in a Supreme Court ruling, is unfortunately keeping us stuck from really evolving as a society. And I think when you speak and when you just shared on the international level, how can we evolve? And when you've gone to places such as the UN and can actually see the impact of people that want to do the good work, and if you allow them the ability to do the good work, great work can happen. We also have many other examples currently in the world where people are being affected and detrimentally, and yet we are being told or constantly challenged or gaslit into questioning what we're seeing with our very own eyes. So I think it's time for us to wake up, and I completely believe that if accessibility for our patients and our people changes, we can actually have an impact of collective consciousness or an awakening to shift the way we live, shift the way we show up, and to really create and cultivate countries that we can be completely proud of when we represent.
Exactly. You are so right. I mean, as we come together as a collective consciousness, and I think it's happening right now at this moment as we speak. You and me both, we have seen people, and sometimes you don't always need the huge organization. Sometimes you're just doing it grassroots level,
Right.
and it starts to spread like wildfire. And it's spreading like wildfire right now. And the big governments are catching on, and people are not taking it anymore. I'm so happy for it. Some of these Gen Zs are not taking it. They are speaking out, and they are like, they're taking the social media and they're using that to make change. And I'm happy for the UN. That's where we both were able to connect, which I instantly connected with you. I love everything that you're doing. Um, and right now, I'm still looking at just the children. I'm looking at prevention, right?
Right.
Because especially for BIPOC people.
Yeah.
Before it was almost like a taboo when we looked at BIPOC people, when we looked at like suicide and things of that nature. But right now, it's at an all-time high on a rise. It used to be like this shame, like a stigma and the shame behind it, especially cultural and traditional things. And now it's at a rise. And we're looking at how can we look at prevention? How can we support these children in a grassroots level and their parents too? And we're looking at, like you said, children that are in stressors. They're having exposed to extended stressors or trauma during war, during different issues. And the child could be have that genius gene in them, but it won't be able to flourish if they don't have a safe space. How will we create safe spaces in every industry, right?
Right.
How would we create safe spaces? If we look at most people that say they're dealing with bipolar or they're dealing with anxiety, and a lot of these people before that, they actually had a traumatic experience, and they all say they didn't have a safe space.
Right.
Just imagine if this new generation, we looked at prevention versus, okay, we're looking at this diagnosis. Okay, we know we got to put you on some drugs, take this medication, and we'll see you and stuff like that. But then the ramifications of this medication, what does it look like in regards to like prevention? Because I feel like, especially Western medicine, right?
Right.
The focus is the cure, right?
Right.
But if we could put more into prevention work, I feel like there could be so much that can change. And especially when we start with children and also the adults now, because they still have never really had a safe space. And that integration, your idea of like, how can clinics and with the VA, also working with the VA and things of that nature, internationally, or even bases or any medical hospital, how can they look at implementing safe spaces, whether it's doctor to patient or just the environment and staff, that culture? How do you implement that within, say you have your own private practice, what does that look like? Can you give any type of advice to those that are trying to create that space? Because I see a lot of people are moving towards the integration of integrative wellness within their practice. But what does that look like versus checking off the box, but actually implementing it?
Right. I think what you're alluding to is the mental health crisis that we're seeing at an all-time high. And I have done some work in mental health, and I've been part of actually what we've had a provincial collaborative, which was created because the suicide rate was so detrimental and a negative shift in our own backyard, that we realize that the impact, we have to surround ourselves around the family, and that is the child and the parent. And when we look at this collaboration, I mean, there was multiple sectors that came together to create an allyship, and that was from policing, from healthcare, from justice to education, and the ministries of children and family development and services. So it was everyone co-creating, and we had our own agendas in which our organizations were represented. But the most important and crucial piece was that the parent and the child were at the center of that, and that they were guiding what their needs were. And again, like a wraparound scenario is that we have the opportunity in our clinic spaces or in our multidisciplinary spaces to create a safe space in which children and families can actually participate. And from that, we've had educational pieces, which are really important. So there are many adults that are still unhealed children. And then we have these unhealed children that are trying to parent children. And many times we just need to become conscious of our own unhealed wounds, do that work in order to raise a child. I think parenting has been not given the credit that it needs to be. And I think we've assumed that it's a simple task of just having a child, rearing the child, and clothing the child. But it is so much more complex than that. Our children's needs, we need to be attentive to the traumas that we may be just passing on generation to generation. There's so many inherited intergenerational traumas that we see, and patterns that repeat themselves. We can look at teenage pregnancy, we can look at drug use, we can look at mental health. And many times mental health and substance use, especially in our adolescent population, go hand in hand. And that's concurrent disorders, is understanding that there's many kids that are maybe undiagnosed or underdiagnosed and are self-medicating with substances or gaming or different addictions. And that what we're seeing that is, becoming more and more prevalent, which makes it teenage brain. It's very rampant in the change and the complexities of how many hormones and influences it has to go through. So if we understand that these children are highly vulnerable, we need to bring them in and to help understand how they need support and what things in our environments are actually making it worse. And we now saw your Surgeon General or your previous Surgeon General wanting to put restrictions on the social media. And that is actually really interesting too, because thinking about how children's brains are, this might be a strong word, but manipulated at times by certain environments, can actually detrimentally affect their mental health. We know that with women, teenage girls, adolescents, the impact of social media from cyberbullying or just body image and awareness has having negative influence on mental health. So children need a safe zone where they can come for counseling, for education, for leaning in and really allowing themselves to open up about what they're facing. There's so much isolation and there's so much shame still surrounding the stigma with mental health that we need to break the barriers down and create safe spaces, youth spaces, which I find we have a project that was started here by a colleague and a friend of mine. It's called The Foundry, and it's a youth space. It's a youth hub that has physicians and clinicians, psychologists. There's a variety of adult helpers, and the youth come to it's like a group hub where they can have therapy, they can have fun, they can have alternative ways of doing something that there is meaningful, a way to give back and also contribute, but heal at the same time. So that would be a dream if we could have access. You know, we've got Boys and Girls Clubs all across America. I mean, an amazing idea, if it's not already being done, is to create a mobile team where a psychologist, maybe a physician that can help them with their other physical health as well as their mental health diagnosing and treatment plans, but also a place to have fun and be a child, be a kid and play. I think we get away from play. We're looking at rates of depression and the association with lack of community or connection and isolation contributing to depression. Also, the lack of joy and thinking of the circumstances of other children. But if you bring them together and if they have a shared understanding, even people that have had underprivileged or marginalized, if we bring those children together and they play and you bring it down to just the simple things and provide food, shelter, water, safety, they can play without having to think about the stress of where they are going back to. And we see that with athletics. We see that with sport. We see that with encouraging youth to participate in sports. I'm a big believer in that. I think athletics and sport have a very large way of taking children out of high-risk populations and giving them an alternative. So I think building spaces where we can cultivate a shared understanding and a safe space for our youth is integral to ways that we can actually circumvent some of the detriments of what we're seeing today.
Wow. Oh my God, you just warmed my heart. Oh, and the community piece, I think we're losing that. You know, we thrive in tribes and in community, and I think we're losing that, and we need more of that community and those safe spaces, like you stated. If you could say one thing to the younger version of yourself, what would you say to her?
I would say, don't stay in spaces where it doesn't serve your spirit.
Wow, that's beautiful. And I'm just grateful for all of the work that you're doing. You are a bright light and a blessing to so many in this world. And for those that want to check out everything that you're doing, any projects and new work, could you please share that with the people, please?
Yes, absolutely. Well, I don't post as well on social media, but I do have a website if people want to connect. I do need to update what the projects I've been working on. I do have a problem, shamelessly shiny, with promoting myself or what the work I'm doing. I'm really committed to the stuff I'm doing, but I think most of the resources you can, Google and see what I'm part of. But I think right now my biggest work I've been working on is I am created a healthcare justice alliance, and where I have paired lawyers and doctors together to build conversations, and we're having a pretty large collective impact, and we're transforming the family justice space right now. I've had a little bit of experience in disruption of our primary healthcare system, reforming the payment model and the remuneration strategies for primary care providers, and that in the hope will create better primary care services for our patients and access over time. And one of my newest ventures is I'm the incoming president of the Federation of Medical Women of Canada. And if you don't know who that is, check us out. This is in our centennial year. It's going to be 100 years of women making dramatic change. That's been in Canada. So everything from women's rights in the OR to reproductive rights and justice. I've also been privileged to be working with AMWA in some capacity that has brought me in to talk about healthcare equity and gender equity. And we have so many people that are making a change on the ground. Another thing plugged to the youth is that get involved. There's always an opportunity for you to contribute even in a small contribution or any way you can to leave the world a little bit better of a place. But I really do think it's going to take all of us.
Wow. And if you see below, I put the website right there. So make sure that you follow and check out everything that's going on the website. And I just feel like, the world needs all of us. We are the village, and it takes a village to raise a child, but it takes a village to raise us all up and raise this vibration and this collective consciousness for us to make change in a big way. And it's not just me, it's not just you, it's everyone.
Right.
We're calling on all of you all. We're challenging you. So let's do this work and continue to support everything that the doctor is doing. And so the last thing I wanted to ask you was, if you weren't a doctor,
Yeah,
what other thing do you feel like you would have had done if you had your own? If you could do anything else, what would you have done?
I think I would have been a human rights activist. Yeah.
You're already doing it.
Trying to amalgamate the two now somehow. But yeah, and look at the time we're in. But yeah, I think the world is in profound need of thought leadership. So I call on all of those people that have something of magnitude to contribute, which is all of you. And especially when we're on the right side of wanting the best for every human and not just ourselves, and seeing how much of the world can actually change when we make small ripples of change. Slowly, we can definitely make change. And now is the time to ensure that we're not going backwards, but that our Gen Zs can show the world that we are going up from here.
And on that note, this is another episode of self-discovery, and I hope you look within and find that beautiful light that lies within you, and you're able to spread it. Don't dim it for anyone. Life may throw you a curveball, but remember, you're in charge of the direction it goes. So love and share the love, and we thank you so much, Doctor, for all that you're doing in the world.
Thank you. Thank you so much for having me.
Thank you.